Sakthi Dental Clinic Mullukurichi. Dental fillings are materials used to restore teeth that have been damaged by decay or trauma. The filling material is used to fill the cavity created by the decay or to repair a cracked or broken tooth. The most common materials used for dental fillings include 1. Amalgam fillings. Amalgam fillings are made from a combination of metals including mercury, silver, tin, and copper. They are very strong and long-lasting but are less commonly used today due to concerns about the safety of mercury. 2. Composite fillings. Composite fillings are made from a mixture of plastic and glass materials. They can be color matched to the natural color of the tooth, making them a popular choice for filling teeth in the visible areas of the mouth. They are not as strong as amalgam fillings but are still very durable. 3. Ceramic fillings. Ceramic fillings, also known as porcelain fillings, are made from a type of dental ceramic material. They are very strong and durable, and they are also color matched to the natural color of the tooth. The process for getting a filling typically involves numbing the area around the tooth with local anesthesia and removing the decay or damaged portion of the tooth. The filling material is then placed in the cavity or on the surface of the tooth and shaped to restore the natural contour and function of the tooth. The filling is then cured or hardened using a special light or chemical process. It's important to maintain good oral hygiene to prevent the need for dental fillings. Regular brushing, flossing, and dental checkups can help to prevent decay and other dental problems that can lead to the need for fillings. Thanks for watching. Like and subscribe.